My name is Erin, and in this video I'm going to be talking about my port surgery and my experience with my port surgery and how things went. So I just got my port surgery yesterday, and right now this is what it looks like. I guess I'll start off by saying, with me just having pacemaker surgery a little over a month ago, this was nothing compared to getting a pacemaker implanted. It definitely does hurt, but it cannot compare to getting a pacemaker implanted. If you haven't had any surgery like this, I would say it's probably going to put you out for probably 3 or 4 days, something like that. I really don't know. It's only day 2 and I've been perfectly fine. It's a little bit sore to me, but I have a high pain tolerance. I know a lot of people like to say they have a high pain tolerance, but I do. I guess first thing, you get to the hospital, I got mine done in interventional radiology, which is usually where you get ports and PICCs placed. I have had a PICC line in the past, so I guess in the future I'll be able to do a video on the pros and cons of having a PICC line versus having a port, but this is already better than having a PICC line. My experience with a PICC line was pretty horrible. Get to the hospital, go to interventional radiology, check in like normal. They take you back, you go into a hospital room, and they put you in a room with a bed. A nurse comes in, asks you all the questions they have to ask you, put your IV in, and get everything started. I'm used to having, I guess, pretty major surgeries, so I'm used to the anesthesiologist coming in beforehand and talking to you and getting a plan down of, basically they will give you a choice of what kind of anesthesia you want. And I'm used to the doctor, the surgeon, coming in and talking to you beforehand. This was not the case for this procedure. I had a nurse walk into the room after my check-in nurse was done, placed my IV and everything. I had a nurse come in and she's like, "Do you need to use the bathroom before the procedure?" And I was like, "No, I just was wondering when the anesthesiologist and doctor were gonna come in and speak to me." And she says, like, "Oh, honey, no. We don't do that for these kind of procedures. This is not a major surgery, so it's not the same kind of thing." So I immediately got really scared. I want to be put out for my surgery. When I had my EP study ablation for my heart, it was under twilight anesthesia, which is what they usually do for this. It did not go well. I crashed. I had to be put under general anesthesia and intubated, and apparently I was trying to like fight the doctors and stuff. I have no idea what happened because I don't remember, thank God. It didn't go well, and my cardiologist and I also talked about how we wanted the port to actually be put in so that it doesn't interfere with my pacemaker and my pacemaker leads and everything. And I was like, oh my gosh, I don't get to talk to them about anything. I just have to go back there and whatever happens, happens. And I've watched plenty of videos on YouTube of people getting ports placed, and sometimes they're like in their armpit. My pacemaker is already in my armpit and it already is annoying to me. That kind of, you don't really have a choice on where it goes, and my pacemaker is rather large. Told the nurse my concerns and everything, and so she wheeled me into the door outside of the operating room early so that I could actually talk to the doctor. And she's like, "There's no anesthesiologist, it's just a nurse practitioner because we don't do general here. We don't do general anesthesia." And I was just concerned because also local anesthesia doesn't work on me. It's a common thing for people with Ehlers-Danlos syndrome that local anesthetics do not work at all or very well. And so that's another reason why I was concerned, because when I got my loop recorder implanted, which you can see it underneath my skin here. So my loop recorder, when I had that implanted, I drove myself there and I drove myself home, so I didn't even have an option of if my anxiety gets high or if I feel something, they can give me something for it. It's basically like when you microchip a dog. It's literally, they just have the loop recorder inside of a plunger. They cut a hole in you and shove it up under your skin and just stick it into you like microchipping an animal. And when I had that done, the local anesthesia did not work on me and I felt the entire procedure. And on top of that, they put a drape over your face. And so you're basically just laying under a sheet and you can't see anything, and you're feeling all of these people do all these things to you. And then on top of that, the anesthetic wasn't working on me and I felt everything, and it was excruciatingly painful. So I was afraid that I was going to be in a situation like that again. But I got to talk to the doctor beforehand. He pretty much made me feel better about everything. Went into the procedure, the operating room, and I was telling them, you know, no, I don't get claustrophobic with them putting the drape over my face, but I had a bad experience in the past and I don't feel comfortable not being able to see what's going on. Yeah. In terms of anesthetic, I just got local anesthetic and they just gave me sedation. They gave me midazolam and fentanyl, which is a pretty strong combination. Since I told them about not being able to see what was going on and not being comfortable with that, they were absolutely amazing. So they're going to drape your entire body because they have to make this a sterile field. You can't breathe on this. So when I say they lay it's like they are laying a blanket over your head. They're laying a sterile sheet over you like you're a dead body, and it will cover your entire head. Some of them are not nice enough to give you room to breathe. They literally just cover your face because it's a fairly quick procedure. It takes about 30 minutes from start to finish. But they had a little plastic thing that they put underneath the side of it that lifted it up for me. And then I asked them if they could roll it back so it wasn't on my face and like I could at least see the room. So they kind of rolled it up and propped it up so that I could see out the side. And then one of the nurses wheels over a TV that they have cameras all over this room from every single angle. But one of the nurses wheels over a TV and puts it directly in front of my face, and it's streaming the entire procedure. So I just laid there with my head to the side. I watched the entire procedure, and one of the nurses that was in there, she was controlling the cameras when the procedure was going on. So she was zooming in on things when he was doing it. So it was kind of cool that I got to watch the whole thing. That basically made all of the anxiety that I had go away. On top of that, the local anesthetic did not work on me. I did have to ask him to put more on 3 separate occasions, which he did, and then eventually I didn't really feel anything. You will feel pressure, and you will, like, sometimes they push so hard they're like rocking your body. If you've ever seen a medical procedure, they are not nice to your body. It looks pretty horrible when they're doing surgeries and medical procedures on you. But I couldn't feel any pain. Now, like I said, I did feel pain, and I asked for more local anesthetic. He stopped immediately, put more anesthetic in there. It was at least good enough to get me through the whole procedure, and I pretty much didn't feel anything. Another thing was I tend to metabolize medications very, very quickly, and I need high doses of medications. That includes anesthesia and anesthetic medications. Now, this wasn't anesthesia. Midazolam is technically just an anti-anxiety medication, but they give it to you, they call it a calming medication. About 10 minutes into the procedure, I was like, is this sedation supposed to be wearing off already? Because it's like completely wearing off already. And the doctor's like, well, it usually lasts at least an hour to like 6 hours in people, but there are Some people where it metabolizes very quickly in them. I was like, yeah, it's like already gone. Can I please have some more? No problem at all. They gave me some more. Towards the end of the procedure, it was wearing off again, so I asked for more. So they gave me the midazolam fentanyl combination 3 times. They were just really, really nice, really kind. The procedure itself went really well. Got to talk to them about my concerns. My PICC line gave me arrhythmias in the past, so they made sure that they weren't putting the line too far down into my heart. But to give a quick overview of the actual procedure and what they do, they either put it in your jugular vein or they put it in your subclavian vein. My surgeon did a very good job because I got to talk to him about it beforehand. It's more common to have complications with it long term if it's in your subclavian vein. But anytime I've ever seen someone, pictures on Google, people on YouTube, and it's in their jugular vein, the line is fed over their collarbone, and you can see it going all the way up and into their jugular, and that just doesn't sound comfortable to me. I feel like that would probably rub and be annoying, and I don't want to see that. It would probably kind of freak me out. So it is in my jugular vein, but he poked the hole underneath my collarbone. He just did a really good job. I really couldn't be happier. I mean, I did just get it done yesterday, so there is way more that I'll have to figure out about this. But anyway, so first thing to do is they slice you with a scalpel, poke a little hole in here, and then they use ultrasound guidance to poke a needle into whichever vein they're putting it in. Basically, they poke a needle into it, they put a wire over that, they put another wire over that, and then you basically just have this lead wire that has been fed into the vein that they want it in. And then they take another scalpel and they cut where they're going to place the actual port. Make a pocket for it, so they rip your skin off of the muscle to make a pocket for it. And then they get the actual catheter, feed it all the way down, and it goes all the way down into your heart. And then they use a tunneling device to peel up your skin from where the port is actually going to be sitting to the hole that they made that goes into your vein. They use a tunneling device to tunnel underneath. Once they put the actual catheter in, they follow that same tunnel with the catheter and hook it up to the port. Test the port, make sure the port is working, put a couple stitches here and stitch this up. They don't really leave stitches on the outside anymore. They just stitch the inner layers with stitches that dissolve and then put some glue over the top. And then I have these bandages over it. I cannot remember how long they told me to leave these bandages on because it does not say in my paperwork, and I was very high still on medications when they told me, and they told me at least 2 times. I think they said 24 hours, but I'm gonna leave it on for 48. I googled it and Google gives you like 10 different answers. So I'm gonna go with 48 hours. Can't shower, can't get, well, you can try to shower, but you can't get it wet. So I usually just stick to baths while I have something healing like this. You can probably still see the betadine, iodine that they use on me. It's kind of orangey going all the way up here. And yeah, I have it all over. So no, I don't have a bad spray tan. That is just where they cleaned and made it sterile so they could do the procedure. But yeah, I came home. Everything has been fine. It's a little bit sore, but it is honestly not that bad. I think if I hadn't just had my pacemaker surgery, it would be a little bit worse than what it feels like, but having such a painful experience and bad experience being on the antibiotics that they put me on for my pacemaker, this is literally nothing compared to that. It's just sore. This one itches really bad. You know, when something heals, itches. So this one itches really bad, and it's really just sore. I personally wouldn't call it painful. it's just very sore. You can't lift anything over 10 pounds on the side that they put the port in. They just said a week. My pacemaker is 2 months. So I'm kind of glad I got these done within 2 months of each other because it kind of overlaps. So I don't have another healing period of now I can't lift anything up again. It's all falling within the same, you can't lift anything over 10 pounds for 2 months period. They also don't want you extending your arm out really far, reaching upwards to grab anything, just so everything can heal, nothing gets pulled out of place, and that it just heals up fine. I will be interested to take these off and see what this scar is gonna look like with my pacemaker scar. And I didn't realize how swollen this was in my last videos until now. I'm realizing the swelling is going down and you can see the entire device, which, like I said, is rather large, and it's probably gonna get even more visible, but you can see the whole thing. It's kind of cool, but pacemaker stuff is going super well. I probably won't make another update video on that because it's healed and it's going really well. I'll probably make an update video on that after I actually see my cardiologist again. They just watched me for an hour after the procedure and then sent me home. I had a great nap. I couldn't hardly stay awake in the car on the way home because of the medications they gave me. When I got home, I took like a 3 or 4 hour nap or something like that because of the medications. I couldn't take any actual, I wouldn't anyways because I don't personally, but I couldn't take any kind of pain medication, which includes my migraine medication, because my migraine medication has a pain medication in it. So be aware of the different medications that are in things that are prescribed to you, because you might not realize that your migraine medication, it's like a 3 combo medication, and one of them is a pain medication that you cannot take after you've had, they gave me a fairly high dose of fentanyl because I had to get it 3 times. Anything that is going to make you sleepy, drowsy, or help with pain, you can't take because it can interact with the fentanyl that you had. To put it in the most scary way possible, you can die in your sleep. That probably won't happen and you'll probably be fine, but it's just a precaution. So I've been just taking Tylenol and I've been perfectly fine. Took another nap today because after I have a surgery, my body is pretty exhausted and I will sleep a lot and nap a lot. It's been perfectly fine. Got it done yesterday. Just a little bit sore. That's my experience with my port placement surgery. It will be used for the first time in exactly a week after I got it. So I got it on a Friday. I'll be using it for the first time on a Friday. I hope all goes well because with my PICC line, it, like I said, was a really bad experience. I had to deal with lots of clots. It clotted when they put it in. My entire vein clotted off. I had to get anticoagulant therapy, which those shots are very painful, so I had to be treated for my blood clot. I had a total blood clot in my arm, and then the actual PICC line tubing was clotted as well. So a little bit concerned about that, but the doctor did say he was going to hep lock it, which if you don't know what that means, it means they put heparin inside of your catheter tubing after they have flushed it with saline. And heparin is an anticoagulant medication, so it's supposed to keep any blood clots from forming inside of that tube. So I really won't know that until either I start feeling the pain of a blood clot, which I am familiar with, or when I go in to get my infusion on Friday, if they try to pull back on it and pull some blood out, or if they try to flush the line and it's clotted. But that's the only thing that I'm nervous about. But so far, everything has gone really well, and I'm hoping for the best. I just tell myself that everything is gonna be okay. And if I say that over and over again, then it will be, right? That's how things work. That's it. If you have any questions, comments, anything, feel free to ask me. I would love to answer any questions. But that, I think, is a decent summary of my port placement procedure. Not that big of a deal. Thank you for watching this video, and I hope I'll see you in another one.